experience in providing home health care services such as skilled nursing, physical and occupational therapy, home health aides, and other specialized care to your homes throughout the state. Please tune in every other week as we bring you a range of good information from specialists in the field to help make you more informed and living healthy.
Good evening, everyone.
Good evening.
Welcome. You are listening or watching your Hometown Health Show, and I am Yolanda. Can you hear me?
Yes, I can hear you.
Great.
Can you hear me?
Yes, I can hear you just fine. So again, good evening, and we're here to welcome our very special guest, Mukesh Wadhwa, a nurse practitioner from Genesis Medical Center. Welcome.
Thank you. Thank you for having me.
And I thought that Danielle Thomas and Candice DiBiano were going to be joining us. Have you heard?
Not yet, but they did send me a text that they were going to be ready to come.
Okay, so hopefully they will join us soon. In the meantime, for those who are listening, Danielle Thomas is an RN home health coordinator with Trilogy, and Candice DiBiano is an RN home health care of Broward. So welcome again, and would you please tell us a little bit about yourself and Genesis Medical Center?
Thank you for the opportunity to introduce Genesis Medical Center to the community. Genesis Medical Center, located at on Sample and University, 3000 University Drive, is a center that has been there from last 20 years. Basically, the center provides provides Humana as our main insurance over here, and we provide exemplary services to the community. Hello. Um, Taking all the acute and chronic cases, but we are basically a risk management group doing the Humana care. We do take other insurances, but Humana is our main center with Genesis Medical Center. But we came across Trilogy when we started doing assisted living facilities, where my other company, Mobile Medics, comes into play. And Mobile Medics has been into business for about 15 years, and Genesis has been into business for about 20 years now. It was called Neil Katz MDPA. When we took over, we changed the name to Genesis Medical Center. We are located in a very good location on the second floor with elevators there, and we see all kind of patients ranging anywhere from 18 years to 100 years. I think my oldest client over there is about 102 years. And we've been providing primary care to the clientele, and we've been doing extremely well. Thank you for the support that we've been getting from the community. When we started Genesis Medical Center, we also started Mobile Medics Ancillary Services, which basically provides primary care in the assisted living facilities, right from Pembroke Pines to West Palm Beach. Myself and Dr. Mann, who are the primary holders at Genesis Medical Center, we are board certified. I'm the board certified nurse practitioner, and Dr. Mann is an MD. We both have been doing this thing together from last 15 years. And Mobile Medics that we started, again, causing a confusion, I guess. Mobile Medics, a Medicare business basically, is in partnership with Dr. Uttam Singh, and we both have been doing this part together from last maybe 15 plus years.
Okay, thank you for that information. We have someone just joined us from a Trilogy, I believe. Is this Danielle?
Yes.
Hey, Danielle.
Hi, how are you? Hi, Mukesh.
Hey,
How's it going?
how are you?
Good, how are
Good.
you?
I'm good.
Great.
Good. Yes.
So Danielle, would you just jump in there and tell us a little bit about Trilogy?
Trilogy's a Medicare certified home health agency, and we service most of the state of Florida except Miami and the Keys, and we offer a variety of services, including skilled nursing, physical therapy, occupational therapy, lymphedema, psychiatric nursing, speech therapy. We also do IV infusions. We have social workers, and we also have home health aides. And we're open 7 days a week, and we do same-day admissions, which a lot of agencies don't do. And I've worked with Rakesh for many, many years, and
Right.
the patients that yes, and the patients of his that we have absolutely love him because he spends time with them, quality time, and he's not one of those practitioners that go in and get out. He actually listens to them and he really cares. So we're happy to work with Rakesh.
Confidence. Thank you. And
You're welcome.
like Daniel said, that we do spend a lot of time with the patients, especially in the assisted living facilities, and we do communicate very well with the families to give them an update exactly what we do and how their loved ones are faring in those facilities. And many a times I do help families even to place them if they need help because we know the insides of every facility and how they will be compatible to the loved ones. Every facility is not compatible to everybody. So we do help to guide the families what is the right appropriate facility for them where they will get the optimum care. And definitely, with the support from Trilogy that we get in many of the buildings, it becomes a little easy process because you all become our eyes and ears at the facility along with the facility nurses or LPNs or the aides, and we are able to give them the right approach, what is needed and what care is needed. And that actually, with 15 to 18 years of experience in this field, I feel that you get a bondage of this assisted living facilities of how they work, what is needed, and how we can provide this elderly population with the best care possible.
Absolutely.
That's great.
And
So,
Genesis Medical,
Mukesh,
I'm sorry to interrupt, but Genesis Medical Center does help our elderly population if they need to be placed into these buildings or any, we do give them a guidance. So if anybody has questions, any has concerns, which facility to pick and what are the criteria needed, they can easily reach me at Genesis Medical Center and we will definitely help them.
And his
That's
office
wonderful.
staff is amazing as well.
Yeah.
Yes, thank you. I have
In
good
his office,
staff.
yeah.
Great
I'm there
staff.
about 3 times a week, and they're so polite and very attentive, very nice.
Right, thank you.
So
I
speaking of
appreciate
your
it.
of your
You're welcome.
offices and your practice, what are your hours? And also, you mentioned other locations, affiliations. What hospitals and facility affiliations do you have?
Our office hours are normally from 9 to 5, Monday to Thursday, and on Fridays we are open from 9 to 2. Sorry, we don't have weekend hours, but we can easily be reached at any time of the day. And the best part is when the family members or the patients call us, even after hours, it will be either me or Dr. Mann that will pick up the line. The calls get transferred to us. So definitely at any time of the day, after hours, they need us, we are there. Regarding insurances, like I said, we are basically a Humana center, but we take all insurances, Humana, United Healthcare, Aetna's, Blue Cross Blue Shield, and of course Medicare. And we do all the
I
basic
think it was
primary care.
regarding hospitals.
Hospitals, we are affiliated with University Hospital, Northwest Medical Center, and Coral Springs Medical Center, which is these are the 3 main hospitals in the vicinity. I have affiliations at West Boca Medical Center, Boca Regional, going far north. Going still further south, I have affiliations at FMC and at West Side Regional. I have physicians that will admit for me so that the continuity of care is there at every stage. When my patients go into skilled nursing facilities, say for example in Forum or in Stratford Court, or they come in Margate Health Center, or they go to somewhere in the other neighborhoods, I have people who will take care of it. I am myself there at the Forum and Stratford Court myself, so I do make sure that I get to see those patients. If the patient ends up at not private hospital, I have a hospitalist who will admit for me and give me daily updates on my patients. So we actually, if you look at north, south, east, west, I have the full coverage that we need. And I also want to add one more thing. Uh, I have a team with me that comes with me to the ALFs. It's not just me alone. I have a company that will provide me the lab work that I need. I have a company that will do my X-rays. I have pain management. I have pulmonary, and if I need to get nephrology, I can get nephrology in the group too. So the patients in the facilities, they will get all-rounded approach care that they need, and they do not need to go outside to get help. Everything will be provided to them in the facilities itself. And definitely when Trilogy is there, if I need anything, I can just call you all and the work is taken care of.
That sounds like you've got everything taken care of for the patient. That's wonderful. And I know that Trilogy works with all of their affiliates and all their doctors and practices to keep the process smooth for the patients. On that note, we're going to take a short commercial break. We'll be right back, and when we come back, we'll talk about what it means to be a general practice practitioner. Stay tuned.
Trilogy was established in 2016 by industry experts with over 30 years in home health care operations spanning 30-plus counties throughout the state of Florida. With offices in Jacksonville, Port St. Lucie, West Palm Beach, we strive to provide the most optimal care to our patients in a fun, forward-thinking environment. Our focus is on personal relationships, whether with an employee, a patient, or an outside community. Because we know that when people enjoy what they do, it becomes why they do it. Call Trilogy today at 954-689-6660 and ask for more information. In addition to offering the standard mix of services, SN, PT, OT, speech, MSW, and HHA, we also take great pride in being on the cutting edge and offering care and education to our licensed clinicians in other areas most agencies likely don't offer. Emotional and behavioral health with our psych nursing, biofeedback for bladder incontinence and pelvic pain, chemotherapy, IV hydration, antibiotic and respiratory therapy. Call today at 954-689-6660. Trilogy Home Care. You have been listening to the Trilogy Home Health Show, and if you wish to be a guest on our show, please call us at 561-670-9213 and let us share your knowledge and information with our listeners. Trilogy Home Health Care Show enjoys serving the community and bringing doctors and facilities of interest to help educate and inform the community. Please call us at 561-670-9213 and let us put you on the airwaves with the Trilogy Home Health Show.
Welcome back, everyone. You're listening to your Hometown Health Show, and I'm Yolanda, your host. Mukesh, I understand you're a general practice nurse practitioner. Could you please tell our listeners what that means?
Nurse practitioners are basically physical extenders who have got an extended training after taking a 2-year course in Bachelor's of Nursing, and then they go into Master's, getting an MSN degree, specializing in nursing. Since you mentioned this nurse practitioner, what does it mean? The government just passed a law in March. And the best part of that law that got passed when we were going through this COVID business, that nurse practitioners who have had extensive training under physicians for more than 3,000 hours and have completed 45 credits in differential diagnosis as well as in pharmacology, they will be assigned or given a PCP position. And with that law going into effect just today, they have opened the application where we can apply to be primary cares in this situation and provide exemplary services to our community. And that was a great change with the governor and the state passed, and it has come into effect. Nurse practitioners now, with appropriate training, they can write controlled substances of course to a limited extent, but that is good actually. But they can write and they so that they can practice to the full extent, providing the correct services to the population. Nurse practitioners do exactly what the physicians do and are capable of practicing independently without supervision. And uh, and there is a research that has shown beyond doubts that the care provided by nurse practitioners is equal or better than our counterparts. And not shortening them or what they do, the physicians do an excellent job, but the nurse practitioners are working very hard in the facilities, in private practices, giving them the complete care, that is the total care. I said treating them as a holistic, not just treating their parts, but treating it as a whole. And they spend more time with the patients, they listen to them and do whatever is needed to provide them the best service. But I'm so happy that today the application process has opened, and after a long wait, that we now can apply directly to get the PCP or the primary care uh, banner under us, so that we can practice without protocols, we can practice to our full extent and use our knowledge in the right basis. So that's what a nurse practitioner is, and they have been trained. And fortunately, I am also one of those persons that train nurse practitioners. I do a lot of preceptorship in my office in the ALFs, uh, training these new graduates that are going to come out and teach them what the right approach is and how to balance between their knowledge and to do everything in the scope of their practice.
Wow, thank you for that explanation, and that's wonderful news. I hadn't heard that before. That's congratulations.
Oh, thank you. Thank you.
So, on that note, let's talk about how you're dealing with the global pandemic. Can you tell us what you're able to do as far as providing services?
This is a very challenging time that we are going through, and taking all the precautions that are needed. Very strong advocate that we need to wear the mask, we need to keep our social distance, we need to use proper sanitization things. How are we coping with it? It's a very difficult question because all of us, we are going through, that is including Daniel, including you, and all the people who are attached into the air. Especially, I'm going to concentrate on the assisted living facilities. The reason I want to focus on that part is because that is the most vulnerable population that we are dealing with. If, God forbid, unfortunately, a case happens to be a positive one, it will spread into the community very rampantly, and it will be a problem. Yes, many communities have gone through this issue where they've had several cases that are positive. Going into these communities and giving them the right support is a challenging task for us. That because you are going from one building to the other building, you do not want to be a carrier yourself, because that's one of the biggest precautions that we have to take. Getting ourselves testing every week to be sure we are negative, so that we do not spread and we are not the cause or we are not the source of the spread. We all have to work together to get this animal out of this world. But how we are going to do it is what the CDC guidelines, what Dr. Fauci has said. We have to strictly follow those rules and regulations that have been set up. Families getting upset that they were not allowed to come into the buildings, families saying, "Oh, we are restricted." Yes, I understand all that, and I sympathize with them that they cannot communicate with their loved ones. And I have spoken to many families. So when I go in and I find the situation, I pick up the phone and talk to the families and let them know how their loved ones are doing. And I have even done some FaceTime calls when I am in the building so that they know exactly how they are going through. But the biggest problem that we are seeing, and which Trilogy has to come as coming into play, because of this pandemic, we are noticing depression, we are noticing decline in their function, the dementia is getting worse. the patients have become very lethargic, or what we call a decondition would be the right word, is secondary to lack of socialization, lack of coming out in from their rooms, staying indoor has created a big problem. Though those conditions have been laxed and now the dining rooms have opened, the entertainment has come back, but the damage has already been done. So it will take months for us to work with these clientele and get them back to their functional level. Unfortunately, families are not understanding this part, and I cannot forget that one of the instances where a family member went in to see their loved ones was the source. And there were 29 patients that tested positive in that building just about 4 weeks ago. And it was because they came up with the letter stating that, hey, the governor has told me that I can come in, let me go in. They didn't test, they were positive, and they gave it to the parents, and the parents gave it to the workers, and the workers spread it out. So we have to be really careful. I understand that you want to see your loved ones, you want to take care of them, you want to do and show. It's all right, but you have to take the precautions that are needed. Get yourself tested. Be sure that you're COVID negative and go in there and then do what you need to do with the proper attire, with the proper mask, with the proper gloves, with the proper gown that you need to wear and go into these buildings. This is the challenge that we face, and we are scared of it too. But if we work together, we can overcome it very easily. That's what I feel.
Def- Definitely, definitely. It's a very scary situation we're in right now. Speaking of having to provide service over the phone, are you doing or having to rely on telemedicine? And what is your preferred mode of providing services, whether it be in your
I
office
prefer
or in?
patients who come to my office, they are definitely screened, and because I have to be sure that my staff is taken care of. Like you said, I have a very nice staff, and they do take care of a lot of things. So we do scrutinize the patient, but we encourage them to come to the office because doing more of a face to face makes them comfortable, makes me comfortable that we have really examined them, we have done the right thing, we've done their labs, because we do all labs in our office, do the proper EKGs and give them the right care. So the patients do appreciate that this is what we are doing. Initially in the ALS, when I was not allowed to go in, I was doing a lot of telehealth, but I was never satisfied with it. And I would tell my counterpart, Dr. Uttam Singh, I'm not enjoying what I'm doing. You're asking the same question, you're doing the same thing, but it doesn't give you the feel. The patient doesn't get the satisfaction until you touch the patient, let them feel how important they are. And you can only do this if you are in the building. So I actually spoke to the regional of one of the ALFs that I go, and I said, listen, you need to let me come in. I test myself every week. We are negative. These patients need to be seen. There are wounds that need to be addressed. Seeing them on picture, because the picture doesn't give you a right thing when they take a photograph and send you. How the lighting is, how sometimes it gets enhanced too much, and sometimes it is not enhanced at all. But you go there and physically see it, you know the difference. So that's what I have started doing. And when they have let me in, I prefer going into the buildings, touching the patients, and I tell my patients, come to my office. I would like to definitely examine you physically. I have a few, my telehealth has gone down to maybe 2 3% now compared to what I was doing 100%. And my visits to all ALFs is back to where I used to do. Every facility lets me in now.
See how amazing
Thank you
he
for that.
is? See how he cares?
Yeah, that's wonderful.
Right.
That's wonderful.
It,
We are
it's a,
running out of time. I want to thank you both for coming on. Mukesh, if you could let our listeners and viewers know how they can get a hold of you.
It's very easy. My office phone number is 954-753-0300. And just ask for me. I will always be there. If you leave your number, I will definitely return my calls. And for my patients who are in the assisted living facilities, they can easily reach me at 954-562-5855. I always answer my call. It's my personal line. I don't hesitate giving out my numbers. They can call me because I feel communication is the most important thing, and that makes the families more comfortable that they can talk to me and they can reach me, and whatever we need to do, we can do, and we can provide them with the exemplary services. If they need help to be placed into some assisted living facilities, I can guide them, but I have no financial affiliation with any of these ALFs that they have to pay me or the families have to pay me. No, not at all. Not a dime is exchanged in that. This is a service that I like to do, but only thing is that I keep those patients, I see them on a regular basis. That's all.
And finally, what's your location and your website?
My address is 3000 University Drive, Suite 1, Coral Springs, Florida 33065. I'm located just off Sample and University. And if they need any help and guidance, don't hesitate to reach us. We are the big providers at Genesis Medical Center.
Thanks again. Thank you, Danielle Thomas from Trilogy, and thank you, Mukesh, for joining us.
Thank you.
It's been a pleasure.
Thank you.
Have a
very
great
much.
evening.
Appreciate it.
Trilogy Home Healthcare invites you to call our offices before making a decision about your home health and rehabilitative care. Different from other agencies, Trilogy offers specialized service that other agencies don't, providing exceptional care. That's who we are and what we do. Call us at 866-599-4959 or go to trilogyhomehealthcare.com.